Question 1. A 29-year-old G2P1 woman at 40 weeks gestation is admitted in active labor. She is receiving oxytocin for labor augmentation. Continuous electronic fetal monitoring reveals a baseline fetal heart rate of 145 bpm with moderate variability. Over the last 20 minutes, recurrent decelerations are noted that begin after the peak of each contraction and return to baseline after the contraction ends. The nurse notes that uterine contractions are occurring every 2 minutes and lasting 75 to 90 seconds. Which of the following is the nurse's priority interpretation and action? A. This is a reassuring fetal heart pattern, continue monitoring. B. The fetus is experiencing cord compression, reposition to supine. C. The fetus is experiencing uteroplacental insufficiency, discontinue oxytocin and reposition. D. This indicates fetal sleep cycle, no intervention required. Answer, C. The fetus is experiencing uteroplacental insufficiency, discontinue oxytocin and reposition. Rationale. Late decelerations are characterized by decelerations that begin after the peak of the contraction, indicating uteroplacental insufficiency, meaning the fetus is not receiving adequate oxygen during contractions. The presence of recurrent late decelerations, especially with frequent contractions, tachysystole, due to oxytocin, is non-reassuring. Priority interventions include stopping oxytocin, remove stressor. Repositioning, left lateral, to improve perfusion. Oxygen administration if needed. Options A and D are incorrect because late decelerations are not reassuring. Option B is incorrect because cord compression causes variable decelerations, not late. Question 2. A laboring patient at 38 weeks gestation is noted to have a fetal heart rate baseline of 130 bpm with moderate variability. Abrupt decreases in fetal heart rate to 90 bpm occur, varying in duration, depth, and timing relative to contractions. Some decelerations resemble a V shape and occur before, during, and after contractions. What is the most likely cause of this pattern? A. Head compression. B. Umbilical cord compression. C. Uteroplacental insufficiency. D. Fetal hypoxia due to maternal hypotension. Answer, B. Umbilical cord compression. Rationale. Variable decelerations are abrupt drops in FHR. Variable timing, before/during/after contractions. Often V or U-shaped. These are classic signs of umbilical cord compression. Head compression causes early decelerations, gradual, mirror contractions. Late decelerations are linked to uteroplacental insufficiency. Maternal hypotension can cause late decelerations, not variable. Question 3. A prima gravida at 39 weeks is in the second stage of labor. The fetal monitor shows a baseline of 140 bpm with moderate variability. The nurse observes gradual decreases in fetal heart rate that mirror uterine contractions, with nadirs occurring at the peak of contractions. How should the nurse interpret this pattern? A. Non-reassuring pattern requiring immediate intervention. B. Early decelerations due to fetal head compression. C. Late decelerations due to placental insufficiency. D. Variable decelerations due to cord prolapse. Answer, B. Early decelerations due to fetal head compression. Rationale. Early decelerations. Gradual onset and return. Mirror contractions. Caused by fetal head compression. They are benign and expected, especially during second-stage labor. No intervention is needed beyond monitoring. Question 4. A patient in labor has the following fetal monitoring strip. Baseline, 170 bpm. Variability, minimal. Recurrent late decelerations. The patient has a temperature of 38.9 degrees Celsius 102 degrees Fahrenheit. What is the most likely explanation for this fetal heart rate pattern? A. Fetal sleep cycle. B. Maternal fever leading to fetal tachycardia. C. Umbilical cord compression. D. Maternal hypotension. Answer: B. Maternal fever leading to fetal tachycardia. Rationale: fetal tachycardia, greater than 160 bpm, is commonly caused by maternal fever/infection, dehydration, fetal hypoxia. Minimal variability plus late decelerations equals worsening fetal compromise. This is non-reassuring and requires urgent intervention. Treat fever. Improve oxygenation. Prepare for possible delivery. Question 5. A nurse observes a fetal heart rate tracing with absent variability and recurrent variable decelerations. The patient is 41 weeks gestation with oligohydramnios. What is the nurse's priority intervention? A. Continue monitoring, this is expected post-term. B. Increase oxytocin infusion. C. Prepare for amnio infusion. D. Place patient in supine position. Answer: C. Prepare for amnio infusion. Rationale: variable decelerations plus oligohydramnios suggest cord compression due to low fluid. Amnio infusion increases fluid volume, reduces cord compression, improves fetal oxygenation. Supine positioning worsens compression. Oxytocin increases stress. Question 6. A laboring patient suddenly develops prolonged deceleration lasting 4 minutes, with fetal heart rate dropping to 80 bpm. The nurse notes a sudden gush of fluid and palpates a pulsating structure in the vagina. What is the priority nursing action? A. Administer oxygen. B. Reposition patient to left lateral. C. Call for emergency assistance and elevate presenting part. D. Increase 4 fluids. Answer: C. Call for emergency assistance and elevate presenting part. Rationale: this is umbilical cord prolapse, a true emergency. Priority: relieve cord compression manually. Call for emergency C-section. Other interventions are secondary. Question 7. A fetal heart rate strip shows baseline 135 bpm. Moderate variability. Accelerations present. No decelerations. How should the nurse interpret this tracing? A. Category I, normal. B. Category 2, indeterminate. C. Category 3, abnormal. D. Requires immediate intervention. Answer: A. Category I, normal. Rationale: Category I includes normal baseline, 110 to 160. Moderate variability. No late/variable decelerations. Accelerations may or may not be present. This is reassuring. Question 8. A laboring patient receiving epidural anesthesia develops hypotension. Shortly after, the fetal monitor shows recurrent late decelerations. What is the priority nursing intervention? A. Increase oxytocin. B. Reposition and administer 4 fluid bolus. C. Encourage pushing. D. Perform vaginal exam. Answer: B. Reposition and administer 4 fluid bolus. Rationale: epidural hypotension, placental perfusion, late decelerations. Treatment: 4 fluids. Left lateral positioning. Possibly vasopressors. Question 9. A fetus demonstrates sinusoidal pattern on fetal monitoring. What is the most likely associated condition? A. Fetal sleep cycle. B. Severe fetal anemia. C. Cord compression. D. Maternal dehydration. Answer: B. Severe fetal anemia. Rationale: sinusoidal pattern. Smooth, wave-like pattern. No variability. Indicates severe fetal compromise, often. Fetal anemia. Hemorrhage. This is Category 3 immediate intervention. Question 10. A nurse notes minimal variability in a fetal heart rate tracing. The patient recently received morphine for pain relief. What is the most appropriate interpretation? A. Fetal hypoxia. B. Medication effect. C. Cord compression. D. Placental insufficiency. Answer: B. Medication effect. Rationale: minimal variability can be caused by sleep cycle, medications, opioids, magnesium sulfate. Hypoxia, if persistent plus other signs. Since morphine was given, this is likely temporary and expected. Question 11. A 34-year-old G3P2 woman at 41 weeks gestation is undergoing induction of labor with oxytocin. The fetal monitor reveals baseline FHR, 155 BPM. Variability, minimal. Recurrent late decelerations. Uterine contractions every 1.5 minutes lasting 90 seconds. The nurse has already repositioned the patient and administered oxygen without improvement. What is the next priority nursing action? A. Increase oxytocin to improve labor progress. B. Discontinue oxytocin infusion immediately. C. Perform vaginal examination. D. Encourage pushing efforts. Answer: B. Discontinue oxytocin infusion immediately. Rationale: this scenario shows tachysystole, excessively frequent contractions, recurrent late decelerations, minimal variability. This indicates fetal hypoxia due to uteroplacental insufficiency worsened by oxytocin. Priority: stop oxytocin immediately. Reduce uterine stimulation. Other interventions come after removing the cause. Question 12. A laboring patient's fetal tracing shows baseline, 120 BPM. Moderate variability. Recurrent variable decelerations that worsen with each contraction. Slow return to baseline. Which finding indicates worsening fetal compromise? A. Moderate variability. B. Presence of decelerations. C. Slow return to baseline after deceleration. D. Baseline of 120 BPM. Answer: C. Slow return to baseline after deceleration. Rationale: variable decelerations are common, but worsening signs include increasing depth/duration, delayed return to baseline, loss of variability. This suggests increasing cord compression and fetal hypoxia. Question 13. A nurse observes a fetal heart tracing with baseline, 140 BPM. Absent variability. No accelerations. Recurrent late decelerations. What is the classification of this tracing? A. Category I. B. Category 2. C. Category 3. D. Normal variant. Answer: C. Category 3. Rationale: Category 3 includes absent variability and one of recurrent late decelerations, recurrent variable decelerations, bradycardia. This is abnormal and requires immediate intervention. Question 14. A patient in labor is noted to have recurrent variable decelerations. The nurse repositions the patient, but the pattern persists. The provider orders an amnio infusion. What is the primary purpose of this intervention? A. Increase uterine contractions. B. Reduce fetal heart rate variability. C. Alleviate umbilical cord compression. D. Stimulate fetal movement. Answer: C. Alleviate umbilical cord compression. Rationale: amnio infusion instills fluid into the uterus, floats the umbilical cord, reduces compression. Used especially in oligohydramnios or persistent variable decelerations. Question 15. A fetal heart tracing shows. Baseline, 100 BPM. Moderate variability. No decelerations. How should the nurse interpret this finding? A. Category I tracing. B. Category 2 tracing. C. Category 3 tracing. D. Requires immediate delivery. Answer, B. Category 2 tracing. Rationale. Baseline less than 110 BPM equals bradycardia, which automatically excludes category I. However, moderate variability is reassuring. Thus, category 2, indeterminate. Question 16. A nurse notes recurrent early decelerations during labor. Which nursing action is most appropriate? A. Administer oxygen. B. Reposition patient. C. Continue to monitor labor progress. D. Prepare for emergency delivery. Answer, C. Continue to monitor labor progress. Rationale. Early decelerations. Caused by head compression. Benign and expected. No intervention required. Question 17. A patient in labor develops sudden fetal bradycardia to 70 BPM lasting 5 minutes. The nurse has repositioned the patient, stopped oxytocin, and administered oxygen with no improvement. What is the next priority action? A. Continue monitoring. B. Prepare for immediate operative delivery. C. Administer analgesics. D. Encourage pushing. Answer, B. Prepare for immediate operative delivery. Rationale. Prolonged bradycardia, 3-5 minutes. Indicates severe fetal hypoxia. If unresponsive to interventions, emergency delivery is required. Question 18. A fetal tracing demonstrates. Baseline, 150 BPM. Minimal variability. No accelerations. No decelerations. The fetus has been inactive for 25 minutes. What is the best nursing action? A. Prepare for cesarean delivery. B. Continue observation, possible sleep cycle. C. Start oxytocin. D. Administer tocolytics. Answer, B. Continue observation, possible sleep cycle. Rationale. Minimal variability can occur during fetal sleep cycles, 20 to 40 minutes. No decelerations equals reassuring for now. Question 19. A nurse notes recurrent late decelerations in a patient lying supine. What is the most appropriate initial intervention? A. Administer oxytocin. B. Reposition to left lateral position. C. Perform vaginal exam. D. Increase for sedation. Answer, B. Reposition to left lateral position. Rationale. Supine position compresses vena cava placental perfusion. Fix. Left lateral positioning improves blood flow. Question 20. A fetal monitor shows. Baseline, 165 BPM. Moderate variability. Presence of accelerations. No decelerations. How should this tracing be classified? A. Category I. B. Category 2. C. Category 3. D. Abnormal. Answer, B. Category 2. Rationale. Tachycardia, greater than 160 BPM, automatically excludes category I. However, moderate variability plus accelerations equals reassuring. Thus, category 2, indeterminate but likely okay. Question 21. A 30-year-old G2P1 patient at 39 weeks is receiving oxytocin for labor augmentation. The fetal monitor shows. Baseline, 145 BPM. Moderate variability. Recurrent late decelerations. Contractions, every 2 minutes, 90 seconds duration. The nurse has already repositioned the patient, administered oxygen, and started 4 fluid bolus. The decelerations persist. What is the next best action? A. Continue monitoring and document findings. B. Increase oxytocin to improve labor progress. C. Notify the provider for possible cesarean delivery. D. Administer tocolytics to stop contractions. Answer: C. Notify the provider for possible cesarean delivery. Rationale: persistent late decelerations after intrauterine resuscitation indicate ongoing uteroplacental insufficiency. Oxytocin should not be increased. Tocolytics may be considered only if provider deems it safe, but the priority is provider notification for possible operative delivery. Question 22. During a routine fetal assessment, the nurse observes a sinusoidal pattern. Baseline, 150 bpm. Smooth, wave-like oscillations. No variability. No accelerations. Which of the following conditions is most likely present? A. Normal fetal sleep cycle. B. Severe fetal anemia or hypoxia. C. Umbilical cord compression. D. Maternal dehydration. Answer: B. Severe fetal anemia or hypoxia. Rationale: a sinusoidal pattern indicates severe fetal compromise, usually due to fetal anemia, e.g., isoimmunization, fetal hemorrhage, or profound hypoxia. Immediate intervention is required. This is Category 3. Question 23. A laboring patient's fetal monitor shows baseline, 140 bpm. Moderate variability. Recurrent variable decelerations with slow return to baseline. Which intervention should the nurse implement first? A. Reposition the patient. B. Increase oxytocin infusion. C. Prepare for emergency cesarean. D. Administer analgesics. Answer: A. Reposition the patient. Rationale: variable decelerations are typically caused by umbilical cord compression. Initial intervention, repositioning, usually left lateral or knee chest. If persistent, prepare for amnio infusion. Oxytocin should not be increased. Question 24. A patient's fetus shows baseline, 155 bpm. Minimal variability. Recurrent late decelerations. The patient received magnesium sulfate for preeclampsia 30 minutes ago. What is the most likely cause of minimal variability? A. Fetal hypoxia. B. Medication effect from magnesium sulfate. C. Umbilical cord compression. D. Fetal sleep cycle. Answer: B. Medication effect from magnesium sulfate. Rationale: magnesium sulfate depresses the CNS temporary minimal variability. Late deceleration still indicate uteroplacental insufficiency, but minimal variability may be medication-related. Monitoring continues with supportive measures. Question 25. During labor, the fetal heart tracing shows abrupt, deep variable decelerations with a V shape, returning quickly to baseline, occurring with every contraction. The patient's membranes are intact, and amniotic fluid is adequate. What is the most appropriate next nursing action? A. Prepare for emergency cesarean. B. Perform amnio infusion. C. Reposition the patient and monitor. D. Increase oxytocin. Answer: C. Reposition the patient and monitor. Rationale: cord compression is most likely cause. With adequate fluid and intact membranes, simple repositioning is the first step. If decelerations persist despite repositioning, then consider amnio infusion. Question 26. A 32-week preterm labor patient has a fetal heart rate tracing. Baseline, 160 bpm. Minimal variability. No accelerations. What is the priority nursing interpretation? A. Category I, normal preterm tracing. B. Category 2, indeterminate, could be fetal sleep. C. Category 3, abnormal, immediate intervention needed. D. Expected in preterm fetus. Answer, B. Category 2, indeterminate, could be fetal sleep. Rationale. Preterm fetuses often show minimal variability. Absence of decelerations and presence of baseline within range equals Category 2, indeterminate. Continuous monitoring is indicated, but not immediately emergent. Question 27. A laboring patient develops sudden fetal bradycardia to 80 bpm, associated with prolonged variable deceleration lasting 5 minutes. The patient's presenting part is high, and the membranes have ruptured. Which condition is most likely causing this pattern? A. Umbilical cord prolapse. B. Fetal sleep cycle. C. Maternal hypotension. D. Early deceleration. Answer, A. Umbilical cord prolapse. Rationale. Prolonged bradycardia plus ruptured membranes plus high presenting part equals classic cord prolapse. Emergency measures, elevate presenting part, call for operative delivery. Question 28. A patient in active labor shows baseline, 140 bpm. Moderate variability. Early decelerations during each contraction. What is the best nursing response? A. Administer oxygen. B. Continue labor and monitoring. C. Notify provider immediately. D. Prepare for emergency cesarean. Answer, B. Continue labor and monitoring. Rationale. Early decelerations equals head compression. Benign, no interventions required. Continue routine monitoring. Question 29. A patient's fetal tracing shows baseline, 170 bpm. Moderate variability. Recurrent late decelerations. Patient lying supine. Which action is highest priority? A. Increase oxytocin. B. Reposition patient to left lateral. C. Administer analgesics. D. Prepare for operative delivery. Answer, B. Reposition patient to left lateral. Rationale. Supine compresses vena cava decreased placental perfusion. Repositioning improves uteroplacental blood flow, may reduce late decelerations. Question 30. A laboring patient has a fetal monitor showing baseline, 140 bpm. Minimal variability. No accelerations. Recurrent late decelerations. Which combination of interventions is appropriate simultaneously? A. Reposition patient, administer oxygen, for fluid bolus. B. Increase oxytocin, encourage pushing, perform amniotomy. C. Continue monitoring only. D. Prepare for immediate operative delivery without interventions. Answer, A. Reposition patient, administer oxygen, for fluid bolus. Rationale. Recurrent late decelerations equals uteroplacental insufficiency. Initial intrauterine resuscitation. Reposition improves perfusion. Oxygen increases fetal oxygenation. For fluids correct maternal hypotension or hypovolemia. If no improvement notify provider for possible operative delivery. Question 31. A 36-year-old G3P2 at 40 weeks gestation is receiving oxytocin. The fetal monitor shows baseline, 150 bpm. Minimal variability. Recurrent late decelerations. Contractions, every 1.5 minutes, 90 seconds duration. The patient has been repositioned, given oxygen, and started on 4 fluids, but the tracing does not improve. What is the next best action? A. Increase oxytocin to speed labor. B. Notify provider for possible cesarean delivery. C. Continue to monitor. D. Encourage maternal pushing. Answer, B. Notify provider for possible cesarean delivery. Rationale. Persistent late decelerations with minimal variability despite interventions equals ongoing uteroplacental insufficiency. Oxytocin would worsen fetal hypoxia. Immediate provider notification for operative delivery is required. Question 32. During labor, a fetal heart tracing shows. Baseline, 145 bpm. Moderate variability. Recurrent variable decelerations. Slow return to baseline. The patient's membranes are intact, amniotic fluid is normal, and she is in left lateral position. What is the priority nursing action? A. Perform amnio-infusion. B. Continue monitoring only. C. Prepare for emergency cesarean. D. Increase oxytocin infusion. Answer. Perform amnio-infusion. Rationale. Persistent variable decelerations with slow return despite repositioning indicate ongoing cord compression. Amnio-infusion adds fluid to cushion the cord. Oxytocin should not be increased. Question 33. A laboring patient presents with baseline, 100 bpm. Minimal variability. No accelerations. Recurrent late decelerations. What is the priority classification and action? A. Category I, continue monitoring. B. Category II, observe. C. Category III, initiate emergency intrauterine resuscitation. D. Normal variant, no intervention. Answer. C. Category III, initiate emergency intrauterine resuscitation. Rationale. Bradycardia plus absent/minimal variability plus late decelerations equals Category 3. Requires immediate intrauterine resuscitation. Reposition. Oxygen. For fluids. Stop oxytocin. Notify provider for possible operative delivery. Question 34. A patient's fetal monitor shows. Baseline, 170 bpm. Moderate variability. Presence of accelerations. No decelerations. How should this tracing be classified? A. Category I. B. Category II. C. Category III. D. Abnormal. Answer. B. Category II. Rationale. Tachycardia, greater than 160 bpm, excludes Category I. Moderate variability plus accelerations equals reassuring otherwise, but indeterminate, Category 2. Question 35. During labor, the fetal monitor shows. Baseline, 135 bpm. Moderate variability. Recurrent early decelerations. No late decelerations. Which nursing action is most appropriate? A. Prepare for emergency cesarean. B. Continue routine monitoring. C. Administer oxygen. D. Reposition patient. Answer. B. Continue routine monitoring. Rationale. Early decelerations equals head compression. Benign, no interventions required. Continue monitoring labor progress. Question 36. A patient in active labor develops. Sudden bradycardia to 80 bpm lasting 5 minutes. Prolonged variable deceleration. Ruptured membranes and high presenting part. What is the priority nursing action? A. Administer oxygen and continue monitoring. B. Elevate presenting part and call for immediate cesarean. C. Encourage maternal pushing. D. Increase oxytocin. Answer. B. Elevate presenting part and call for immediate cesarean. Rationale. Classic umbilical cord prolapse scenario. Immediate relief of cord compression and rapid operative delivery are critical. Oxygen and monitoring are secondary measures. Question 37. A fetal monitor shows. Baseline, 140 bpm. Minimal variability. No accelerations. Recurrent late decelerations. The patient has received epidural anesthesia, and blood pressure is 85/50ths mmHg. What is the priority nursing action? A. Increase oxytocin. B. Reposition to left lateral and administer 4 fluid bolus. C. Encourage pushing. D. Administer analgesics. Answer: B. Reposition to left lateral and administer 4 fluid bolus. Rationale: epidural maternal hypotension decreased uteroplacental perfusion late decelerations. Correct hypoperfusion first, fluids plus lateral positioning. Oxytocin or pushing could worsen fetal hypoxia. Question 38. A patient's fetus shows a sinusoidal pattern. Baseline, 150 bpm. Smooth, wave-like oscillations. No variability. No accelerations. What is the priority nursing action? A. Continue monitoring. Likely fetal sleep cycle. B. Administer oxygen and 4 fluids. C. Notify provider immediately, prepare for emergent delivery. D. Reposition patient. Answer: C. Notify provider immediately, prepare for emergent delivery. Rationale: sinusoidal pattern equals severe fetal compromise, anemia, hypoxia. Immediate interventions needed. This is category 3. Question 39. A laboring patient shows. Baseline, 140 bpm. Moderate variability. Recurrent variable decelerations. Slow return to baseline. Repositioning has not improved the pattern. What is the next priority intervention? A. Administer oxygen. B. Amnio infusion. C. Increase oxytocin. D. Encourage pushing. Answer: B. Amnio infusion. Rationale: persistent variable decelerations, cord compression. Initial step, reposition, failed amnio infusion indicated. Oxygen can be adjunct, oxytocin may worsen, pushing not appropriate. Question 40. A patient in labor shows. Baseline, 145 bpm. Moderate variability. Recurrent late decelerations. The patient has been repositioned, given oxygen, and started on 4 fluids, but decelerations persist. What is the most appropriate next step? A. Continue monitoring. B. Increase oxytocin to expedite delivery. C. Notify provider for potential operative delivery. D. Encourage maternal pushing. Answer: C. Notify provider for potential operative delivery. Rationale: persistent late decelerations equals ongoing uteroplacental insufficiency. Standard intrauterine resuscitation steps, failed operative delivery may be required. Question 41. A 28-year-old G1 at 40 weeks gestation is in active labor. The fetal monitor shows. Baseline, 155 bpm. Minimal variability. Recurrent late decelerations. Contractions every 1.5 minutes. The patient has been repositioned, oxygen administered, and 4 fluids started. What is the next priority nursing action? A. Increase oxytocin to speed labor. B. Continue monitoring. C. Notify provider for possible operative delivery. D. Encourage maternal pushing. Answer: C. Notify provider for possible operative delivery. Rationale: persistent late decelerations with minimal variability equals ongoing uteroplacental insufficiency. Oxytocin would worsen fetal hypoxia. Immediate provider notification for possible operative delivery is required. Question 42. A laboring patient shows. Baseline, 120 bpm. Moderate variability. Recurrent variable decelerations with slow return to baseline. The patient's membranes are ruptured, and amniotic fluid is low. What is the priority nursing intervention? A. Reposition patient and monitor. B. Perform amnio infusion. C. Increase oxytocin. D. Prepare for emergency cesarean. Answer: B. Perform amnio infusion. Rationale: variable decelerations plus oligohydramnios cord compression. Amnio infusion cushions the cord, improving oxygenation. Repositioning is done first, but with low fluid, amnio infusion is indicated. Oxytocin may worsen stress on the fetus. Question 43. A fetal tracing shows baseline, 165 bpm. Minimal variability. No accelerations. Recurrent late decelerations. The patient received magnesium sulfate for preeclampsia 30 minutes ago. What is the likely cause of minimal variability? A. Fetal hypoxia. B. Medication effect from magnesium sulfate. C. Umbilical cord compression. D. Fetal sleep cycle. Answer: B. Medication effect from magnesium sulfate. Rationale: magnesium sulfate depresses fetal CNS temporary minimal variability. Late decelerations are still concerning. Treat underlying uteroplacental insufficiency. Monitoring continues with supportive interventions. Question 44. A patient's fetal monitor shows baseline, 140 bpm. Moderate variability. Recurrent early decelerations. What is the appropriate nursing response? A. Notify provider immediately. B. Administer oxygen. C. Continue routine monitoring. D. Prepare for cesarean delivery. Answer: C. Continue routine monitoring. Rationale: early decelerations equals head compression, benign. No intervention required. Continue monitoring labor progress. Question 45. A patient develops prolonged variable deceleration lasting 5 minutes during labor. Membranes are ruptured, and the fetal presenting part is high. What is the most likely cause? A. Umbilical cord prolapse. B. Maternal hypotension. C. Fetal sleep cycle. D. Early deceleration. Answer: A. Umbilical cord prolapse. Rationale: prolonged bradycardia plus high presenting part plus ruptured membranes equals cord prolapse emergency. Immediate measures: elevate presenting part, call for operative delivery. Question 46. A patient's fetal monitor shows baseline, 150 bpm. Moderate variability. Recurrent variable decelerations. Slow return to baseline. Repositioning and oxygen have been attempted without improvement. What is the next step? A. Administer 4 fluids. B. Perform amnio infusion. C. Increase oxytocin. D. Encourage maternal pushing. Answer: B. Perform amnio infusion. Rationale: persistent variable decelerations indicate cord compression. Amnio infusion adds cushioning fluid. Oxygen or repositioning alone is insufficient. Oxytocin or pushing could worsen stress. Question 47. A fetal tracing demonstrates baseline, 100 bpm. Minimal variability. Recurrent late decelerations. What is the priority classification and intervention? A. Category I, continue monitoring. B. Category 2, observe. C. Category 3, initiate emergency intrauterine resuscitation. D. Normal variant. No intervention. Answer: C. Category 3, initiate emergency intrauterine resuscitation. Rationale: bradycardia plus minimal variability plus late decelerations equals Category 3. Immediate actions: reposition patient. Administer oxygen. For fluid bolus. Stop oxytocin. Notify provider for possible operative delivery. Question 48. A laboring patient develops sinusoidal fetal heart rate pattern. Baseline, 150 BPM. Smooth, wave-like oscillations. No variability. No accelerations. What is the priority nursing action? A. Continue routine monitoring. B. Administer oxygen and 4 fluids. C. Notify provider immediately, prepare for emergent delivery. D. Reposition patient. Answer: C. Notify provider immediately, prepare for emergent delivery. Rationale: sinusoidal pattern equals severe fetal compromise. Common causes: fetal anemia, hypoxia. Immediate provider notification and preparation for delivery are required. Question 49. A patient's fetal monitor shows. Baseline, 145 BPM. Moderate variability. Recurrent late decelerations. After repositioning, oxygen, and 4 fluids, the decelerations persist. What is the next priority action? A. Continue monitoring. B. Increase oxytocin. C. Notify provider for potential operative delivery. D. Encourage pushing. Answer: C. Notify provider for potential operative delivery. Rationale: persistent late decelerations equals non-reassuring fetal status. Standard intrauterine resuscitation steps failed operative delivery may be required. Oxytocin or pushing would worsen fetal hypoxia. Question 50. A laboring patient presents with. Baseline, 140 BPM. Minimal variability. Recurrent late decelerations. Which combination of interventions is appropriate simultaneously? A. Reposition patient, administer oxygen, for fluid bolus. B. Increase oxytocin, encourage pushing, perform amniotomy. C. Continue monitoring only. D. Prepare for immediate operative delivery without interventions. Answer: A. Reposition patient, administer oxygen, for fluid bolus. Rationale: persistent late decelerations uteroplacental insufficiency. Initial intrauterine resuscitation. Reposition improves perfusion. Oxygen increases fetal oxygenation. For fluids correct maternal hypotension. If no improvement, notify provider for possible operative delivery. You've now completed a full set of 50 advanced NCLEX fetal heart rate scenarios, covering every major pattern from early, late, and variable decelerations to sinusoidal rhythms, tachycardia, bradycardia, and minimal/absent variability. Mastering these patterns and their priority interventions is essential for safe obstetric care and rapid, evidence-based decision-making. Consistent practice with these scenarios will sharpen your clinical reasoning, improve your ability to recognize non-reassuring fetal heart patterns, and strengthen your confidence in managing high-stakes labor situations. Remember, early recognition, proper intrauterine resuscitation, and timely escalation are the keys to optimal fetal outcomes. Keep reviewing, stay systematic, and trust your clinical judgment.